Good evening everyone. This is Dr. Apurva Shewale from Shewale Hospital and Ajanta IVF. Today we are going to discuss a very basic topic about what investigations are required for a female and male before to get their primary analysis or primary infertility or fertility analysis. So in a female partner, what is required? Mainly, you will require a day 2 AMH testing. Serum AMH tells us the amount of antral follicles present in that female's body, meaning what is her fertility potential in these coming days. Because a female has a limited fertility potential, this test has to be done as soon as possible if you are suffering from infertility and should be done on day 2 or day 3 of your cycles to give an accurate report. What other tests are required? First, your basic blood test, your CBCs, your blood groups, your serological testing, HIV, HBsAg, VDRL. Along with this, serum prolactin and a thyroid, TSH, free T3, free T4 is also very important. So that if there are some preventable causes which cause infertility, we can actually tackle that. In the recurrent or secondary pregnancy failures, you can add in a torch panel or some other genetic testing if and when required. Otherwise, in the husband, you must do a semen analysis or a sperm function test. You can either go for a manual semen analysis, or if you have done that and not found good results, you can also go for an automated or an AI1 semen analysis. We here at Ajanta IVF use LensHook's X1 Pro for this automated semen analysis. Along with this, the male partner also has to do a CBC to rule out infections and has to do serological test and a blood group test. After this, after both your tests have come to us, we can suggest what kind of treatment you will require in your infertility journey. Either you can go for a PR cycle, that is a planned relation cycle, or an IUI cycle, or an IVF cycle. So a planned relation cycle is basically us assisting your natural fertility by giving us some ovulogens. What are ovulogens? Ovulogens are tablets or injections which will increase your follicular count. I mean, when you have a day 2, the follicles are small, and as you go towards day 10 or day 14, whichever is the ovulatory day in your cycle, this follicle starts becoming big before it ruptures. This is known as ovulation. So we can give some ovulatory drugs or ovulogens. Sometimes a female might require only tablets and get good results out of it. Sometimes we might need to add 2 or 3 injections more. After this, after the follicle has reached a 20 mm size, we can give an HCG trigger so that the female ovulates. After the ovulatory effect, we can ask the male and the female partner to keep relation on the day and an alternate day as the ovum survives 32 to 36 hours in the body. So after this, we also give medications. So if there is pregnancy, it will support your pregnancy in the endometrium. Next, what is an IUI and who needs to go for an IUI? IUI is not required for all. IUI is intrauterine insemination. If in your semen analysis there is asthenospermia, that is that the motile count is low, those people might require an IUI. In an IUI procedure, we wash the semen and with a small catheter, we transfer it transvaginally into the woman's womb. This procedure does not require any kind of general anesthesia and is a daycare procedure. So the procedure before the IUI is the same as a planned relation cycle where you are given ovulogens to increase your follicular count and cause the rupture, and after the rupture, after 32 hours of the rupture, we do an IUI. IUI is a daycare procedure, and IUI wash samples give us 100% motility in a normospermic sample, and in a less asthenospermic sample we can get less motility, but grade 4, that is progressive motility, is more. in those samples, and the chances of fertilization increase as well. After this, you have to take medication. So if you have pregnancy, it will support the pregnancy. After this, if you have multiple failed PR cycles, multiple failed IUI cycles, or absolute indications for IVF such as asthenospermia, aspermia, these procedures might require an IVF. So these patients can go for IVF treatment. IVF treatment is a little more complicated than IUI and a PR cycle, in which the female has to take hormonal injections, and after the follicle has reached a 20 mm size, we give the trigger and pick up the follicles right out from the ovum using a transvaginal scan. In this, you get a general anesthesia and you will be admitted for a day or so, or can be discharged on the same day depending upon your condition. After an ovum pickup, an ICSI is performed or an IVF is performed in the lab, and after fertilization, this embryo, that is your future baby, is transferred in your womb by embryo transfer. Embryo transfer might require general anesthesia or might not, depending upon the female situation. We transfer the ovum via the vaginal tract into the uterus in an ET catheter. All these procedures will be discussed in further, but if you have any doubts or any further queries, please contact me at Shewale Hospital and Ajanta IVF. I am Dr. Apurva Shewale and I will guide you in your infertility journey.